सुरू झालं? ठीक आहे. तू बाहेरच थांब, मी एकदा हे करते, मग तुला बोलवते. एकदा पाहून घेते. Very good morning, everybody. Myself, Dr. Neelam Pande, working as a professor and postgraduate teacher at VSPM Dental College, Nagpur, Maharashtra. Outline of this presentation. The title is Mouth Preparations in Removable Partial Dental Prosthodontics. Learning objectives, broad objectives, pre-prosthetic mouth preparations, prosthetic mouth preparations, conclusions and references. So, learning objectives. The mouth preparations for removable partial dentures are identified as those procedures that are accomplished to prepare the mouth for the resection of the prosthesis. The postgraduate students must know what is mouth preparations for partial dentures, the purpose of mouth preparations, various procedures, and applications in tooth-borne as well as tooth-tissue-borne partially dentulous situations. The broad objectives are to establish the state of health of the mouth and oral cavity, to eliminate interferences or obstructions to placement and removal and functions of the prosthesis, to establish an acceptable occlusal plane and occlusal scheme, and to alter natural tooth form to achieve a form and function of the prosthesis. So the topic is divided into following contents. There are broadly classified pre-prosthetic mouth preparations and prosthetic mouth preparations. So mouth preparations. Once after the diagnosis and treatment planning and the clinical and radiological examination, we confirm that we come to the conclusion that the patient or the individual is the suitable candidate for cast partial denture. So mouth preparations for removal partial denture impression is denture construction is directed towards the reduction of stresses in order to protect and preserve the tooth, teeth and tissues. The pre-construction planning should not only include the improvement of the existing conditions, but also prevent the inclusion of new stresses over the abutment, surrounding abutment natural teeth as well as the underlying tissues. The mouth preparation in term intended to cover all types of changes effected in the mouth, foundation ridges, or other oral structures that may be seen necessary to accomplish a better partial denture result, as given by Applegate. Coming to the pre-prosthetic considerations, in that the first point is relief of pain and infections. Here, prevention of acute episodes is the main purpose. There are various endodontic and surgical procedures carried out for the various regions. The gingival inflammatory tissues and periodontal abscess should be treated. At the same time, scaling, root planning, and prophylaxis should be done. The treatment of potential emergencies causing conditions is the important part in this aspect. Oral surgical procedures. The extractions, retained roots and root remnants in impacted and unerected teeth, malpose teeth should be removed or extracted. If these retained structures are not removed, it may erupt beneath the dentures and may aggravate the pathosis or it may after the period of it may develop symptoms after the period of wear of the prosthesis. Hello Ranjit. Hello. At the same time, general tuberculosis, polyps, papillomas, or traumatic hemangioma should be excised by surgical procedures. If these retained structures are not removed, it may it may either beneath the dentures or may aggravate the pathosis, or it may develop symptoms after a period of year of the processes. Similarly, um, cyst or odontogenic tumors may interfere sitting and removal of the denture uh, and eventually causes soreness. So this should be excised. Myeloid ridge, sometimes it is sharp. So these sharp ridges may interfere in all steps during construction of the partial denture, like in example impression making or after um, or impression making. So these sharp edges should be surgically removed by bone trimming. Genial tuberculosis, polyps, papillomas, or traumatic hemangiomas should also be removed surgically to make the foundation tissue more comfortable. Mm. The tissue recontouring required by prosthetic modifications include torus palatinus and torus mandibularus, because they may affect the design of the prosthesis and major connector and design. Although for the smaller, small sized torus, various other designs of major connectors are available, but generally the elimination of these um, bony growth is the is favorable. मी दुपारी पाहते दुपारी. Then hyperplastic tissues, most commonly on the residual ridges and on the palate, are also seen. The removal of these tissues generally improves the foundation of the denture. Sometimes the maxillary tuberosity, because of may overhang, and this may interfere the occlusal plane. So it has to be recontoured by surgical procedures. Then correction of occlusal plane and discrepancies. Because of uneven pattern of extraction or exfoliation of the teeth, the occlusal, this happens because of uneven pattern of extraction or exfoliation of the teeth. So supra occlusion of the opposing dentition is there is and it interferes the occlusal plane. So and placement of the artificial teeth. So that's why there is need to correct it. For mild supraocclusion, recontour or reduction of the tooth is advised. For moderate root canal treatment, intentional root canal treatment followed by crown is advised. Whereas for severe occlusion, severe supraocclusion, extraction of that tooth is the main treatment. Similarly, tilting of the adjacent teeth is also correction of tipping and tilting of adjacent teeth is also important. If it is minor, it can be corrected by enameloplasty. If it is more, onlays or crowns are given. Individual tooth modifications consist of correction of sharp unwound cusp by reduction of cuspal inclination and heavily abraded teeth by reduction of buccolingual width. Restoring the normal occlusal plane is very, very important. When the occlusal surface of the tilted or rotated abutment teeth is below the occlusal plane, onlays or crowns are given on such teeth. After endodontic correction of malaligned teeth. Malaligned teeth is also main concern during construction of cast partial denture. If it is minor, it can be corrected by recontouring of the axial surfaces. If it is moderate, by it can be placing the crowns is the placing of artificial crowns is the treatment advice. Whereas severe malocclusions will definitely severe malocclusions definitely requires orthodontic corrections. Then periodontal considerations. This for any abutment teeth, primary or for all the periodontal ligament supports the natural teeth, mainly the principal abutment teeth. So the objectives for and the success of restoration depends directly on the health and integrity of the supporting structures of the remaining teeth. So healthy periodontium and gingival tissue is very, very important. The objectives of periodontal treatment is removal and control of all etiological factors, elimination of all pockets and healthy gingival sulci, establishment of functional and non-traumatic occlusal relationship, and tooth stability, and development of personalized plaque control and definitive oral hygiene maintenance program. Again, for periodontally weakened teeth, splinting is advised. Splinting of posterior teeth provides additional resistance to anteroposterior forces, but not mediolateral forces. So, to obtain improved resistance to mediolateral forces, splinting must include one or more anterior teeth. And canine tooth is preferred. In that, canine tooth is preferred because it is strongest, has and has longest roots with sufficient proprioception, and it is a corner tooth and it distributes the stresses evenly. Missing anterior tooth is again one option which is we may come across missing anterior tooth, like in class 3 modification 1 situations. So in such cases, it can be replaced by fixed partial dentures. It provides buttressing effect and provide lateral resistance and L-beam effect. Isolated teeth, single isolated teeth in the arch also needs splint. Single isolated teeth in the arch can be splinted by fixed partial dentures. And in the swing lock partial denture is also advisable when the teeth are can be an option for this periodontally weakened teeth. Weakened teeth adjacent to edentulous space. This is also important aspect, especially in the class 1 and class 2 or distal extension situations where the abutment teeth have decreased periodontal support. So whether this addition should be used for removable partial denture principal abutment or not is again a question. So there are multiple options, either by splinting, which may provide some support and stability, or on that tooth direct retainer can be given by suitable glass assembly, but that may be a failure because it failure but that is not advisable because of failure of compromise too. Mainly extraction, best way is to extract that weakened tooth, which may have sometimes grade 2 or grade 3 mobility, or which may be associated with grade 2 or grade 3 mobility. So this will be a suitable option. Endodontic procedures, severe carious lesions. Sometimes the teeth may have a severe carious lesion, or there can be fractured 1/3 of the 2/3 of the tooth. Tooth with severe caries may require definitely require root canal treatment, and there are sometimes deflective restorations. Caries may involve pulp and unusual contours of the tooth. After endodontic treatment, crown or coping can be used, has to be given on these teeth, and these teeth can be used further as a retainer for the removable partial dentures. Now, establishing the crown continuity by fixed partial denture. Sometimes in class 3 modification 1, we may come across clinical, sometimes we may come across various clinical situations like class 3 modification 1. So, or single isolated abutment tooth, or the fire abutment tooth. So this can be corrected by giving fixed partial dentures, and the actual classification can be modified, and so that suitable treatment can be, suitable design can be planned for that processes. Coming to the prosthetic mouth preparations, these are actual tooth alteration procedures by reshaping, preparation of guiding planes, changing or modification of the height of contour, preparation of retentive undercuts, recessive preparation, and enhancing the retention, are sometimes given complete or partial coverage restoration. So classification of abutments. Mainly these abutments in the removable class partial dentures can be classified as those abutments that require only minor modifications to their coronal portions, or those that have to have restorations other than complete coverage crowns, or those that have to have complete crowns. So coming to one by one, we will see the tooth alteration procedures or reshaping of the tooth is done by enameloplasty. It is a very conservative approach and highly and routinely followed by using carborundum impregnated the low speed by using tapered carbide bursts. Tapered carbide bursts enameloplasty is carried out, and it is highly polished using carborundum impregnated rubber wheel or coin at a low hand speed and light intermittent pressures. This reshaping of the teeth, apart from the natural tooth, can be done on the surfaces of the existing restorations or by placing new restoration. Preparation of guiding planes. It is again important part. The guiding plane surfaces are two or more vertically parallel surfaces of abutment teeth shaped to direct the processes during placement and removal. Characteristics of guiding planes. Let us have the characteristics of guiding planes as it provides direct, distinct path of insertion and removal, thereby retain the processes. It offers improved stability to the processes by providing increased resistance to horizontally directed forces, and they are determined by the path of insertion and follow the natural curvature of the tooth. So these parallel guiding surfaces are prepared by cylindrical diamond or carbide burrs, and burr is placed at high speed, high speed handpiece, and a light sweeping stroke is followed from the facial and line angle to the lingual line angle, and it is then used to create a gentle carving plane. When viewed from the occlusal or gingival surface, it should follow the natural curvature of the tooth. These guiding planes provide increased stability. They help in reciprocation, proper reciprocation, and they prevent the clasp from deformation. So these are the additional benefits of the guiding planes. Mm. Preparation of guiding surfaces. The abutment is adjacent to the tooth supported segments, especially in the class 3 partially dentulous situations. Here, the spur is kept to about 2 to 4 millimeters. These are it has to be prepared about 2 to 4 millimeter occlusal gingival surface, and they should follow the natural curvature of the tooth after complete preparation. After finishing and polishing, they should follow the natural curvature of the tooth. Preparation of guiding planes, the abutment is adjacent to distal extension spaces, as in class 1 or class 2 partially edentulous situations. We have to place the, here it is slightly, there is slight, here the height of the guide plane is slightly reduced, about 1.5 to 2 millimeter from in occlusal gingival area on the proximal side, and the reduced height decreases the contact with the minor connector, that is the proximal plane. Thus, it permits greater freedom of movement for the associated removable partial denture, and ultimately minimizes the potentially destructive torquing forces on the tooth. The lingual surfaces of the abutment teeth, sometimes the guiding planes are prepared, and these are about 2 to 4 millimeter from the lingual surface in the height and location in the middle third of the clinical crown on the lingual surface. The reasons to provide here is they provide sufficient reciprocation, they minimize the number of pathways, and also help to minimize the number of pathways, and they provide maximum resistance to the lateral forces. The preparation of guiding surfaces on anterior tooth. These are again provided to stabilization of the processes, to decrease the undesirable spaces, thus enhancing aesthetics, thus help improve aesthetics, and retention through frictional resistance. So recontouring should be done with the proposed path of insertion and parallel to the path of placement, and parallel to the path of insertion, and to minimize the effect of tipping, and to improve the aesthetic and functional results of the removable partial denture. They also help to close the dead space, black spaces, which are seen immediately, and they also help to provide black spaces adjacent to the denture base and artificial tooth. Changing modification or modification of the height of contour. They are used to provide the favorable positions of the clasp or lingual plating. Position of retentive clasp arm at the junction of the gingival middle third of the sometimes is very important. So generally there is drifting of the maxillary teeth on the buccal surface and mandibular teeth on the lingual surface. So that may affect the actual height of contour. So we need to modify this height of contour by positioning the retentive clasp at the junction of gingival and middle third of the crown, which improves the aesthetics and place the clasp nearer to the center of rotation, and also mechanical characteristics of the denture are improved. These are it is achieved by enameloplasty using tapered diamond burr. Depression of retentive undercuts. This is again important part. This is done by using round or football shaped diamond burr, which is generally called shallow dimpling, which is a retentive undercut on the facial surface of the tooth. And this undercut is 0.010 inch, and here it has to be made on mesiodistally about 4 millimeter and occlusogingivally. The depth is about 4 millimeter mesiodistally and occlusogingivally 3 millimeter. Here, again after completion, the margins has to be rounded off for and smoothened with the carborundum disc, carborundum point. Raced preparation, the prepared surface of the teeth into which rays are called, into which rays fit are called race seats. The primary purpose of race is to provide vertical support for the partial denture to direct the forces of mastication parallel to the long axis of the tooth. It prevents the gingival displacement of the RPD and maintains the clasp assembly components in their planned positions. At the same time, it maintains the established occlusal relationship by preventing the settling of the dentures. This prevents the extrusion of one or more teeth. This race closes small spaces between the teeth and prevents impingement of the soft tissues and food impaction, and thus improves the aesthetics. And it directs and distributes the occlusal loads to the abutment teeth. So the functions of receipts you can very well appreciate in these diagrams. Transmission of forces apically act as a vertical stop and maintains the retentive clasp in its proper position. Now coming to the posterior race seats, the occlusal race seats, posterior race. Coming to the posterior race seats, that the occlusal race seats in enamel, it has to be raised. Yeah. For this, number 4 or 6 or 8 round burr or tapered cylinder is used. The outline of the receipt is rounded, triangular shape, as long as wide, about 2.5 millimeter for both premolars and molars. The floor is apical to the marginal ridge and occlusal surface. It is spoon shaped and thicker in the center of the tooth at the marginal ridge. Thicker in the center of the tooth than the marginal ridge. The post race is about 1.5 to 1.5 millimeter thick and at the marginal ridge. The angle formed by the race tip to the minor connector should always be 90 degrees. So to provide the transmission of occlusal forces along the long axis of the tooth, otherwise there will be, if it is 90 or more than 90 degrees, it may create orthodontic movements. The evaluation of these race tips, the form and depth has to be evaluated by using discs of 4 millimeter thickened and 15 millimeter diameter red boxing wax. The wax is placed into patient after preparation of the receipt. This wax is placed into patient's mouth and ask him to bite, and the tooth surface once we get the imprints, the tooth surface is evaluated to create the anatomy and morphology of the prepared area. And this rests on the existing cast or metal restoration. There should be sufficient space in the existing cast restoration. The adequate tooth preparation is also necessary, otherwise it may result in insufficient thickness and failure of the RPD, either by perforation of the casting or exposure of the tooth surface. So the remaining procedures are same, the preparation procedures and instruments are same as done for enamel surfaces. Sometimes there is a need in class 3 and partial edentulous situations. There is a need to make internal occlusal residues. It is a dotel type depression. Mm, here the it is here it is slightly tapered. It is slightly convergent, which is mainly used in the class 3 partially or tooth-borne partially edentulous situations, depending on the clinical situations, and it helps in horizontal stabilization and it helps to in horizontal stabilization of the partial denture, and because the rest is and helps um, and improves the aesthetics also, and helps in horizontal stabilization and improving aesthetics, improve and aesthetic also improves the aesthetic. On existing restorations, there is the metal ceramic and all ceramic restorations are already present. If the metal ceramic or all ceramic restoration is already present, receipts on these types of restoration is totally contraindicated because the ceramic material is strong and compression and weak in tension, and it may lead to fracture. So, but if there is a need to give metal ceramic receipt entirely, but if there is any need to give the rest, this metal ceramic rest shield should always be should be entirely placed on the metal portion. Mm, should always be placed on the metal portion. So this is the sequence of abutment preparation on some dermal and existing restoration. The proximal surfaces, then the clasp assembly at the junction of middle, retentive clasp assembly at the junction of middle and gingival third, then retentive clasp terminal at the gingival third, and the occlusal residue preparation. Coming to the occlusal residue as a part of new restorations. When one or more teeth restorations, when one or more fixed restorations will be placed in conjunction with RPD partial denture therapy, careful planning and fabrication is required. The occlusal residue here for new restoration should always be planned to prepare to place during tooth preparation, and the rest it is carved in the wax pattern, as we can see in this diagram. And so for the placement, the wax it has to be placed during wax pattern stage. The initial shaping is done by round carbide burr about 4 to 6, number 4 or 6, and the final shaping is done by rounded carver. And after that, the regular spring, investing and casting procedures are carried out. Occlusal residues on amalgam restorations are less desirable and they are not advisable also, but sometimes because it may deform and fracture. But if decided to plan, we have to check the depth and breadth of the restoration, the amount of distribution of remaining tooth structure, and the size and position of the proposed race seat. The race seat should not be placed entirely on amalgam. Some portion of the race seat should be on the sound tooth structure. The occlusal race seats. The occlusal forces is more occlusal race seats. When we compare the occlusal race seats, the occlusal race with the occlusal race seat, the occlusal forces are directly along the long axis of the tooth because of its due to its fabrication and placement area. Whereas cingulum and incisal race seats, due to inclined planes, results in off-axis loading. Coming to the anterior race, that is the cingulum race. Here again the outline is crescent shape. Lingually it is V-shaped. It has to be prepared using number 38 carbide or inverted cone with side and end cutting surfaces and placed on the apical to the contact level of the opposing teeth. Now the cingulum race seat in new cast metal or metal ceramic restorations again are using number 2 or 4 round burrs, and again the preparation should be entirely in the metal portion. Anterior rest on the incisor rest are fabricated proximally on the distal incisor or mezzo incisor surfaces using flame shaped burr. It improves the aesthetics. The notch is created and extended on the facial surface, the channel on the lingual surface, and it is about 2 to 3 millimeters from the proximal angle to the tooth with a depth of 1.5 to 2 millimeters. Now, lingual rest is preferred to the Indians. Coming to the lingual rest, it is located closer to the center of rotational center of the anterior tooth. The longer lever arm, due to its longer lever arm, the incisal rest magnifies the rotational movements. Mm, it also aesthetically it is acceptable because placed on the lingual surface, and the configuration of lingual rest is less subjected to breakage and distortion. Enhanced retentive undercuts. The tooth contours are modified to enhance the existing undercuts. Sometimes, apart from dimpling, sometimes the actual tooth contours in the other areas are also modified. And here also, either by dimpling or by enameloplasty, other areas like you can very well appreciate mainly in the mandibular canine or mandibular molars, mandibular canine or mandibular molars. Mainly the canines and molars are the area, the teeth where where we need to enhance the retentive undercuts. Complete or partial coverage distortions. There sometimes in day-to-day clinical practice, sometimes the teeth displaying caries, deflective distortions, fracture or endodontic treatment may require crown. So recontouring procedure, and in that situation, if there is a need to give, if it is planned to give removable partial denture for the partially dentulous situations, recontouring procedure before treatment, complete or partial crown or fixed is for the proposed partial recontouring procedures before complete and partial crown. Recontouring procedure should be carried out before the fixed partial denture work. Guiding planes for path of insertion and removal for the proposed partial denture has to be made earlier than the fixed restoration, fixed FPD work. Two preparations for complete and partial crown, then tooth preparation for complete or partial crown or fixed partial dentures are carried out. The guiding for this teeth also, the guiding planes and the wax patterns of FPD are made. The surveyor guiding planes and the wax patterns for partial dentures are proposed, are carried out. Guiding plane preparation prepared on the wax pattern for this FPD, which are parallel to those of the remaining natural teeth. Now, at this time, considerations for Marcos teeth also should be carried out. Now, after that, shaping of the axial contours of the wax pattern is done using wax knife on the dental surveyor. Shaping of the wax pattern, the required rest sheets are prepared, re-evaluated, and casting. Now, these required rest sheets are again prepared and re-evaluated, and casting is carried out. After the casting, also after casting, also re-evaluation of the crown, metal crown is done for more preciseness. And this way, these crowns and these complete crowns or fixed partial dentures are ready to support the partial dentures. Now, after complete preparation, the finishing of all these alteration areas are carried out by greenstone, and polishing is done by carborundum impregnated rubber point. This finishing is done with a low speed handpiece for rounding the sharp angles and eliminate scratches formed by the diamond burst. Scratches formed by the diamond burst. Polishing is done by carborundum impregnated rubber point for smoothing the surfaces so that there will not be any plaque or debris deposited on this teeth. So, coming to the conclusion, restoration of partially dentulous arch with successful removal partial denture is one of the greatest challenges facing the dental profession. To ensure this success, hard and soft tissues of the particular arch being restored and associated tissues must be an acceptable biologic state. Today, technological developments of CAD/CAM and rapid prototyping allow the digital treatment planning. CAD/CAM generated mouth preparation guide for the removal partial denture by using particular guiding template is also possible. Still today, in prosthodontics, conventional methods of fabrication of oral prostheses have been considered the gold standard for many years. So, it is almost it is necessary to plan each and every partially dangerous situation. Um, 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 it is necessary. So it is necessary. It is necessary in removable partial dentures, meticulous planning and preparation of mouth is very necessary. Meticulous planning and preparation of mouth preparation is very necessary for favorable prognosis of the treatment. Thank you.